The most news in the morning. CNN's American Morning. Weekday, 6 a.m. Eastern.
A Senate health care reform bill is now back on track, set to be ready by Christmas Eve. And it's really a historic legislation if it makes it through to remake the nation's medical system to cover some 30 million uninsured Americans. And what could it mean if you get sick? And what about the costs involved? Joining us now from Washington, Time national correspondent Karen Tumulty. Good to see you, Karen. And also our own Sanjay Gupta in Atlanta. Karen, first of all, and Sanjay, great to see you as well. Did you think we'd get to this point? I know you've been covering the healthcare debate for a long time. So the Democrats won their major victory in their push for healthcare reform. They got the 60 votes needed to close debate on the floor, and now it's moving forward. So what's next?
Well, first of all, this vote, you're right, it was a procedural vote to cut off a filibuster, but make no mistake, this was the critical vote. What's next is probably passage around 7 o'clock on Christmas Eve, and then this thing goes into a House and Senate conference committee. Now don't forget that the House on November 7th passed this bill by an absolutely razor-thin margin as well. There are some big differences between these two bills, and those are going to have to be ironed out over the next few weeks, probably a few weeks in conference committee.
Yeah, that's one of the things that we're going to be getting to as well. There are a lot of differences. How will they be reconciled? But Sanjay, I want to bring you in here and ask about this. We know that both bills in the House and Senate are extremely complicated. But when you look at what elements are likely to stay in any final bill, what will this mean for the average person and their health care?
That's a great question, and a little bit hard to know exactly what it's going to mean overall, because this is going to be a truly unique system, very different than really any other country on the planet. The hope is that people, as a result of having increased access, are going to be able to visit the doctor more often, get prevention, hopefully be healthier overall, and that's part of this whole idea of bending the cost curve down, trying to keep people healthier, trying to keep them from getting sick in the first place. But there's also this idea that doctors are going to be sort of incentivized differently, doctors, hospitals, healthcare professionals, to try and take care of the patient for whatever problem there is, as opposed to, readmitting the patient, hospitalization after hospitalization. It's called bundling of services, for example, and that might make, again, this idea that the incentives change to keep patients healthy. But again, a lot of this is still sort of unknown overall, and also this idea of cost. What it's really going to cost in the long run is just a little bit hard to say.
Yep, absolutely. I want to get to that in a second. Karen, there are still some major differences, as we talked about. First, in who will ultimately pay for the bill, as Sanjay mentioned, in terms of cost. You got the House package, which has like a 5.5% tax on people making more than $500,000 or $1 million for a household. And then you also have cuts in Medicare spending. Now, when you look at the Senate side, they don't include that surcharge. However, they want to put this 40% tax on so-called Cadillac plans. And these are something adamantly opposed in the House, because many union members have these very, very, very good benefits that they gave up pay in exchange for. So how is that going to get reconciled?
Well, I think that at this point, it's a philosophical difference. It's also a different constituencies, as you said. It's interesting, though, that in the Senate bill at the last minute, Harry Reid added a payroll tax on wealthy people as well. So it does look like, however this comes out, high earners are going to be paying
right, and that would be
somewhat
0.9%, I believe, a 0.9% payroll tax if you make as an individual over $200,000 or as a family over $250,000. And this is where a lot of Republicans have said, wait a minute, you said this wasn't going to affect middle-class people. Arguably, some of those people trying to put kids through school would consider themselves middle class in that category.
Well, and also these people who have these so-called Cadillac healthcare plans are, not just Goldman Sachs partners. They are, in fact, a lot of firefighters and teachers and public sector workers who've negotiated for these generous health benefits in lieu of wage increases.
Right, absolutely.
So
And that's another big thing. And Sanjay, one of the other things that caught my eye in the Senate bill, actually, is it calls for cuts in Medicare, roughly about $500 billion. And I know there's a lot of seniors out there that say, wait a minute, what does that mean for me? Does that mean I'm going to get less services? Am I going to have a change in the doctor-patient relationship because I rely on Medicare for my health?
You know, again, a very good question and a little bit difficult to predict how that's going to play out. Let me point out a couple of things. You know, the people who are supporters of using the Medicare cuts to help pay for this say this is more about creating more efficiencies within Medicare. So, you know, the patients aren't going to feel the $500 billion almost dollars a year worth of cuts. What the people who are critics of this will say is two things. One is this could affect seniors, could affect the care they get. And two, by the way, are these Medicare cuts really going to happen? In the past, when Medicare cuts have been suggested, a lot of times when it comes right down to it, Medicare still gets funded the way that it had been funded in years past. So one, if the cuts happen, could they affect seniors? Two, will they really happen? And if they don't, how do you pay for this?
All right.
Coming back to that.
And quickly, Karen, just quickly if you can, the fines. How are they going to reconcile this? Two different sets of fines in the House and Senate bill for not opting into insurance.
You know, I really don't think there is that great of a difference on that. What the bottom line is that people who do not buy insurance are going to find themselves paying some, and also employers who don't provide insurance to their workers are going to also find themselves paying more to the government. But it's a different way of structuring things, but either way, people are going to pay if they don't have or provide insurance.
Karen Tumulty with Time Magazine and our Dr. Sanjay Gupta. Good discussion on this. Still a lot to be hammered out, but we'll see how it goes. Thanks so much for joining me.